My main fields of research overall are health economics. This is the application of economic and economic principles to the delivery of healthcare and healthcare services all over the world. I work in various aspects of that, mostly on the financing and economics side. And recently, as I arrived here, I finished a book with a colleague from the psychology department at Berkeley. We were very interested in looking at this question of attention deficit and hyperactivity that affects a lot of young school-aged boys and girls, mostly boys. And so as I arrived here, I finished a book with him on looking at attention deficit and hyperactivity all over the world. And I will give a presentation actually on the campus next month on this topic. And the book will come out from Oxford Press in early 2014. I've written books. My book for Stanford Press was looking at the health workforce, particularly physicians, in the United States and around the world. I'm especially interested in the topic of social capital. This is the effect of communities and community organizations on the health of the community. And I've done a variety of research in that area, and I'll be giving a presentation on my work to the economics department here in a few weeks' time. My work is very applied to decisions makers in the government. Particularly, of course, the Department of Health, but also the Health Ministry and the financing of it. And my work has a lot to do with how to change government policy, particularly on the payment of services, the method of payments used to pay for care, and also the ability of the government to reach minorities and underserved populations. So the work is very applied. It has very direct policy suggestions for decision makers to improve the health of the population here in Spain, the United States, and around the world. My project here is to look at global payments in healthcare, how to pay for healthcare around the world, new methods of doing it, particularly in Europe, in Spain, and the United States. And so I'm writing a book on this topic, and I'm working here with some Spanish colleagues to figure out how this is done in Spain, which will be one of the chapters of my book. Last semester, I was a visitor in Santiago, Chile, and I worked on paper performance there with the Minister of Health, and they're doing a variety of experiments. So here I will do some conceptual thinking and some writing on different ways of paying hospitals, doctors, pharmacists, dentists, to encourage them to deliver better, high-quality services to the population and hopefully get more value for money in our healthcare systems around the world. My conclusion so far is that the incentives to improve quality are workable in most healthcare systems. They're extremely complicated, and for them to be successful, you have to work with the physician community. You can't design them in the Ministry of Health or somewhere else. There has to be a cooperative arrangement where the physicians and hospitals understand the new reimbursement system and what it's trying to do so they can accept it better and participate in it, but also help to develop it. And some of the evidence that I've seen from the UK and the United States suggests that these systems are taking hold. And I think the future of healthcare will be more to pay for performance and quality rather than just pay for the services that we get from the doctor.